Hi, my name is Rachel. I'm a nursing student at Rhodes State College. I'm doing my IV push check off. I'm going to enter the patient's room, knock on the door to get permission from the patient. She'll tell me to come in. I'll hand sanitize. I'll introduce myself. Hi, Gladys. My name is Rachel. I'm a nursing student. I am here to give you some IV Lasix. The doctor ordered it because of some edema that you're having in your lower extremities. I'm going to organize my supplies. I will have gloves, a sharps container, a 3 ml syringe for the medication, two 10 ml normal saline syringes, the medication, the Lasix, which is 40 milligrams in a 4 ml vial. The expiration date is 5/23. The expiration date on the syringes is 3/31/2021, and I will also have alcohol swabs and a swab cap. Can I have you verify your name and birthday and your allergies for me? The patient will verify that her name is Gladys Over, that her birthday is 5/18/1951, and that she's allergic to sulfa. I will compare that with the armband and also in the medical record. It's listed there. The physician order was for Lasix 10 milligrams IV push or IM based on a stable weight of 185 pounds daily. If she has 2 or more pounds gained, she will receive 30 milligrams. If there is no weight gain, she will receive 20 milligrams. And if it's 2 or more pounds lost, I will give her 10 milligrams. In addition to that, she will also have 0.9 normal saline flushes, 3 mLs before and after the medication is given. And that the MAR and the order are correct. I'm going to do my calculation now. So the patient's daily weight today is 185 pounds. With that compared to the order, she will receive 20 milligrams of Lasix. The on-hand dose is 4 milliliters and 40 milligrams. And get rid of the mg's. 20 times 4 is 80 mLs, and 40 times 1 is 40. All right, so 40 goes into 80 2 times, so 2 mLs will equal 20 milligrams. Okay? All right, so I'm gonna do my drug book. The medication will be undiluted. It can be diluted with normal saline, D5 and normal saline, lactic ringers, so it's compatible with those solutions. The medication will be, where's that at? Right, the rate of administration is for every 40 milligram or fraction thereof, it should be given over a 1 to 2 minute period. It is a loop diuretic. That means that that means that things that I need to be mindful of are lab values, especially electrolytes and potassium level. I need to be mindful of hypotensive episodes, so she will be considered an increased fall risk after administration due to orthostatic hypotension issues. I will need to assess for increased edema, any issues with the INT site. I will need to monitor for monitor the blood pressure and the pulse rate and possibly cardiac rhythm. And then I will also want to monitor for nausea, vomiting, or any other adverse reaction. So I'm going to do my first check. The patient's name is Gladys Over. Her birthday, or her medication ordered is 20 milligrams of IV Lasix, IV push, for a weight of 185 pounds. Okay. Patient's name is Gladys Over. The medication, the route is IV push. The reason is for edema and the time is now. I'm going to assess the IV site now. The IV site, I'm going to monitor for redness, heat or warmth, coolness, pallor, or pain or edema. And then I will also give 3 mLs of 0.9 normal saline before and after administering the medication. That's part of my first check. Okay, I'm going to do my second check now. The patient's name is Gladys Over. The medication ordered is Lasix 20 milligrams and 0.9 normal saline flushes, 3 mLs before and 3 mLs afterwards. The reason for the medication is for edema. The route is IV push and the time is now. Okay, and then I'm going to also do my third check before I actually, wait a minute. Baby, go. Okay, I'm going to draw the medication up. So, this is a multi-dose vial, so I need to make sure that I scrub the hub for 15 to 20 seconds. Okay, I will lay this alcohol swab flat on my surface or on my work area. I'm gonna withdraw the needle. Let's twist it. I'm gonna withdraw 2 mLs of air and inject that into the vial. There's that. And then I'm gonna draw up 2 mLs of medication. Okay. All right, there's 2 mLs drawn up right here. All right, I'm going to secure my needle. Okay. And then I'm gonna lay it flat on the alcohol swab. Okay. All right. Now I'm gonna do my third check. The medication ordered was Lasix 20 milligrams with a flush of 3 mLs of normal saline, 0.9% before and after the administration. The reason for the medication is for swelling or edema. The time is now. The patient's name is Gladys Over. And the route is IV push. Okay. All right, so I'm gonna grab some gloves. I'm gonna get my, I'm gonna put clean gloves on, remove the swab cap. It's already been removed. And I will clean this site for a period of 15 to 20 minutes, or 15 to 20 seconds, not minutes.
3:45 p.m.
It's 3:45 p.m. Okay, so that's nice and clean. All right. I need to verbalize that I'm gonna flush this, but I need to verbalize that I'm gonna aspirate gently before for blood return if it was a central line. So I am flushing with 3 mLs of normal saline, 0.9%. There is no time limit with this one. All right, there's the flush. All right, and I'll I have the Lasix now. I'm going to screw it on. And this one I will infuse for 1 to 2 minutes and verify with my watch. I want to make sure that I infuse it nice and slow, because if I go too fast, it can cause irreversible tinnitus or hearing loss, and that's a bad thing. So that's why we ensure that it goes nice and slow. All right, so almost to a minute. Okay, there's the medications have been infused over for one to 2 minutes, and now I'm doing my final flush. And this one will be the same 1 to 2 minutes, 3 mLs. The reason why we do the same amount of time is because we don't want to leave any medication indwelling in the tubing and have it pushed too fast during the next flush or medication administration. I will I want to gently flush the INT with the normal saline. And if it was a central line, I want to check for blood returned. So I'm going to start the flush now for 1 to 2 minutes. All right, that was flushed over 1 to 2 minutes. Okay, so the medication has been administered with the flushes. So now I'm going to make sure that I put a new scrub cap on the INT site. At this time, I will discard of all of my syringes and needles into my sharps container, and then I will clean up. I'm gonna recheck the IV site at this point too to make sure that there was no injury or any edema or change in color, pallor, heat, warmth, any of that that stuff. Now I'm going to discard all of my trash in the receptacle below me, and I will ensure that the patient is safe, raising the side rails up, making sure that the bed is low to the ground, that the call light and side table is within reach. I will explain to the patient that I will return in about 30 minutes to reassess, 30 minutes to an hour to reassess, and I will exit the room, and I put the sharps already away, put the hand sanitize, and then I will go out and document that the medication was administered in the MAR. All right. Okay.